Our mission here is to help facilitate and to spread education, in turn empowering parents and caregivers and individuals to better their own health. And we're really excited about the webinars simply because it really is a great platform to get this information out there. And we're really honored today to have you, Dr. Kundel, giving us this information. What is holistic dentistry? So thank you so much for taking the time to share this with all of us. Thank you, and I'm going to silence myself now.
Thank you for welcoming me. It's a pleasure to be here. The first webinar that we're doing today is an introduction. It is to give you, the listener, a taste of what is holistic dentistry. Dentistry in itself is a very complicated universe, and holistic dentistry is an angle of how to look at dentistry in general. The purpose of this webinar is not only to introduce you, but also to get you to think about your healthcare, your choices, your options. To me, holistic dentistry is a state of mind. It's the way I look at my patient. It is the way I look at the mouth. It is the way I think. It governs all my decisions when it comes to my recommendations and treatments. Because I realize that whatever I do for my patient is either helping them or making them worse. It either makes you healthier or it makes you less healthy or makes you sicker. And this is a very important concept to understand. Anything that I do can affect my patient. So it is important for me to process the information in such a way that is really trying to be more responsible. The motto that I came up with myself some time ago, since your mouth is attached to your body, it should be treated as part of your being. It's not just a set of teeth. It is not just a smile. It is a very complicated system which governs central nervous system in a very significant way. And part of it is becoming more and more apparent to people is the mouth controls the airway. And we're going to touch upon it at the end of the webinar. It is not enough, I feel, for your teeth to just sparkle. I think as a patient, you need to be learning something from your dentist, and you need to be healthier when you visit your dentist, not just you want to have cleaner teeth or you want to have straighter teeth. I went online and I found this article which summarizes what holistic dentistry is. It certainly doesn't describe everything. It doesn't describe everything accurately. There are a lot of gray areas, but I would like to go over the points that they made in this article so as to get the ball rolling and to get the discussion going, really. So number one, natural dentists don't use amalgams. I would agree with this because mercury is neurotoxic, at least, has been shown time and time again. And so you don't want to use a material inside of the mouth, especially when it's something so close to the brain, when the material is quite literally dangerous for you. The other option, is, the point number two, is natural dentists don't offer fluoride treatments. I would say for the most part it's true, but I would say that if someone has rampant decay, rampant means, let's say there are 5 to 10 cavities in the mouth. That is a very big problem. Those 5 to 10 cavities are not going to magically resolve if you start taking 1 or 2 supplements. This is a health concern. And so if you need to use medicine to stop the breakdown process, I think it should be used. And once the situation is under control, then you can go back and supplement yourself with whatever your body is missing. But again, if the problem is severe, you have to stop the problem first. Number 3, natural dentists avoid crowns. I would disagree with this, because anyone can call themselves a natural dentist just because they don't use mercury fillings. Most people nowadays don't use mercury fillings because people want to have white teeth. That does not make you, quote-unquote, a natural dentist. There is no natural materials in dentistry. None of them are pesticide-free and antibiotic-free and cruelty-free. All dental materials are man-made. They are plastic, they are metal, they are glass. So what makes a holistic dentist is really a philosophy of treatment, not whether you're going to put a crown on a tooth or not. Sometimes teeth need crowns, sometimes they don't. Perhaps what point 3 should have said is dentists that are holistic are more conservative in their approach. They're less likely to cut your teeth down to put a crown, and they're more likely to go with a well-made filling, because your tooth will be rattled less. It will be cut down less. Number 4, natural dentists don't offer sealants. I don't know about that. Some people do, some people don't. I don't offer sealants because I don't feel there is a need for them. If you take care of your teeth, if your diet is decent, if you brush your teeth, you shouldn't have to have sealants. Sealants oftentimes are made in a hurry by an auxiliary, not even by a dentist, and sometimes decay develops under the sealant and you don't even know about it, and it can create a big problem for the tooth. So I don't know how other people feel about sealants. Sometimes it's an overtreatment, but sometimes if the person is really prone to decay, if the grooves are very deep, if it can be done really judiciously and carefully, it's not necessarily a bad thing. Natural dentists use x-rays sparingly. Again, I don't know if it's true. X-rays are necessary. Some people try to avoid them. I don't think it's wise, because you can see a lot on an x-ray, and if you can see a problem that is small and treat it conservatively, I think it is much wiser than avoiding a problem, having it become a big problem, and then deal with it. So maybe some dentists avoid x-rays, but I just don't think it's a good idea. Natural dentists test filling materials first. Some do, some don't. It's an added expense. The value of it is debatable at times. I used to do it a lot more often. It is sort of also a marketing additive that we test the materials and we'll find which materials are the best for you. There are a lot of arguments about it. Your blood is being tested against these materials. Some people use something called kinesiology. Some people are quite good at kinesiology or muscle testing. Some people aren't. So it all is about trust of your practitioner and how you feel about your treatment. Number 7, natural dentists use homeopathy and vitamin C for invasive surgery. Some do, some don't. Doesn't make you unnatural dentist if you don't use vitamin C for surgery or homeopathy. It's all really about how you look at the world and how you approach your patient. Homeopathy is great, vitamin C is great. Sometimes they work, sometimes they don't. So you need to be aware of those things and use that which your body needs at a particular time and place. Number 8, natural dentists offer infrared devices for healing from surgery instead of painkillers. If you're in pain, take the painkiller, because if you're in pain and you're tolerating the pain, that actually slows down your healing, because you're secreting molecules which are meant to stimulate your body for defensive purposes and not for healing purposes. Infrared devices are great. I use them. They are very helpful, and they can decrease the inflammation and discomfort significantly. However, it does not mean you should take the pain. If something hurts, deal with it. Help yourself. Number 9, natural dentists don't remove wisdom teeth unless they are causing problems. Sometimes true, sometimes don't. If your dentist is conservative in nature, if your dentist doesn't believe that everyone needs surgery, then lucky you. Sometimes teeth need to be taken out, sometimes they don't. If they're completely in bone, perhaps they don't need to be taken out. If your wisdom tooth is sticking out in part and is causing gum problem or a potential cavity, it needs to be taken out. You can't baby it. It will create a problem. So I think it doesn't make me a holistic dentist just because I'm more conservative when it comes to surgery. It just means I'm more careful and I'm thinking of my patient first. Number 10, natural dentists rarely, if ever, do root canals. I would agree with this. I do not do root canals myself. It is a very hot topic for debate. I can only say that if I needed a root canal, I would get rid of my tooth. Because root canals can create a problem. They do create a problem. Oftentimes I see patients that have several root canals and they don't have any health issues. And that's fine. I don't tell them anything about it. But I think people need to be educated, and they need to make their educated decisions based on the information provided to them. But I would agree that most holistic dentists probably do not perform root canals or don't even recommend them. Just to open your horizons further, this is a chart of me treating a patient who needed a denture. On the left, right here, I did an electronic version of an EKG for a person. And this is a snapshot of how healthy central nervous system is of this patient when adapting to stress. And with her old denture, you can see that the yellow is almost in the red, which means it's bad, which means that with the old denture, this patient had difficulty adapting to stress. She may not know about it, but it can also be the person doesn't feel healthy, for example, doesn't feel stable, doesn't feel well rested. There are many different ways you can describe it, but the way the software says is the person has very low adaptability. And as far as 13 levels of functioning of the physiological system, it's not too good. The chart on the right was taken right after the new denture went in. And you can see how the system responded. It made leaps into the green zone, and this is where most people should be. I'm assuming people that don't work out 5 to 7 times a week, that don't eat all organic fruit and vegetable and meat and so on and so forth. So this is where people are most of the time. And the difference is drastic. And all I did was I changed the location of where the teeth are sitting in the mouth. It's as if I did orthodontics without moving any teeth. So this is a very big deal. Going from old denture to a new denture changes how your heart beats. This is the takeaway lesson. Very, very significant. And so what makes a holistic dentist a holistic dentist? A holistic dentist thinks of your entire body, not just your teeth. And so here it's an example. Another highly debated topic as I mentioned before, is mercury. Is mercury safe? Mercury is not safe. Everybody knows that. But is mercury safe in the mouth? The answer, of course, is no. It's just a matter of how much can we adapt to that which is not good for us. And people are pretty adaptable. There's even an expression, the Mad Hatter. The reason that expression is there is because people that used to make hats used mercury to mold the material. And so people literally went crazy when they were exposed to very high amounts of mercury. So there is a reason why we want to avoid it, is because it's simply dangerous. Holistic dentists can be viewed as crazy canal. This root canal most likely is failing because there is a lot of black around the root. This black means there is less bone. The only reason for the bone not to be around the tooth is only when there is infection. If the bone is being eaten away, that means there is bacteria there. And the scary part about this bacteria is they are very, very toxic. A lot of bacteria that live, or all of the bacteria that live in root canals, don't need oxygen. The byproducts of their metabolism is exceptionally toxic to us. And so cavitation is, if you go to the upper picture, you will see this dark area which shows infection in the bone, even though there is no tooth. So this area is a swamp. It's a swamp of pus, dead bone, and byproducts of the battle that is happening between the immune system and the bacteria. And people can have very serious health issues as a result of this. Here is a picture of my patient who had an infection of his foot, and this infection would not resolve with anything that he tried. He tried antibiotics, he tried herbs, he tried homeopathy, he tried anything that he could, and nothing would go away. I found a couple of teeth that were very infected. Teeth came out, and you can see that his foot began to heal. And so you would think, how does it work? The tooth and the foot, everything in the body is connected. I don't have exact answers. How does a tooth affect the foot? But the infections are very dangerous that can come from root canals. And in his case, it happened to manifest in the toe. If you look at this tooth, which is in the upper right corner, you can see that this area here is black. Nothing in the tooth should be black. This most likely is either a bacterial or a fungal infection. This tooth on the bottom, which came out, has a cyst. It's a pus-filled sac, which was also poisoning a patient. So you can see that it may not seem like a big deal, but really it may end up being a big deal. There is plenty of information online about this. There are books, there are articles, and very recently a movie came out, which was on Netflix up until very recently. It's called The Root Cause. It's a story of one person who went through some pretty horrible experiences with his health. He tried everything that he could, yet he always felt like he was going bananas until one tooth came out and he began to recover. So this is a very interesting story. It is unfortunate that Amazon removed it, but they removed it from the pressure, I'm assuming, from the powers that be. Maybe it's American Dental Association, maybe somebody else, I don't know. But the same thing is happening with not only Netflix, but Facebook and Amazon. They're removing titles that are contradictory to whoever decides what is contradictory. So you really need to learn as much as you can, and you need to advocate for yourself and ultimately make your own decisions and take care of yourself. Another thing in dentistry that people are talking about is implants. Which implant is better? And my question is, for whom? Better for whom? Is it better for the dentist, one or the other? Is it better for the patient, one or the other? So on the left, you have a picture of what an implant actually is. A dental implant is a replacement of the root of the tooth. The dental crown is made after the implant is healed in the bone. It's mechanically, it is a wonderful restoration. It definitely is better than having dentures. The downside of an implant is we don't know what effects, what health effects it possibly can have on us. There are articles that are coming out that say that there are some tumor necrosing factors. It's a type of molecule that is found around the implant. The question is it systemic or is it local? Nobody knows yet. But certainly mechanically, it's a wonderful restoration. And if you're in good health, an implant is a wonderful solution. Then there is something called ceramic implant. Ceramic implant is often called a non-metal implant, and it's right here on the right. Technically, it's not correct. It's not a non-metal implant because ceramic implant is made out of zirconia. Zirconia is an earth metal. So molecularly speaking, it's still very much a metallic element. Not element, but composition. They're also very good implants. They have not been in use as long as metal implants have, but they may work just as well. Whether they have any health side effects or not, we also don't know. Supposedly they're better for soft tissue, for gums, but I think all of this remains to be seen. And I think it also is a function of what your immune system is able to handle. So here's a picture of an upper jaw of a patient of mine. And you will see on this picture only that which you know to look for. We just did a couple of minutes of the presentation, and so most of you, I'm sure, will see metal fillings, and so right away the expression will be this patient has mercury fillings. They need to be replaced. I don't know if they need to be replaced, but there is more to the picture that the eye can see, and so I'm just trying to open the horizons to get you to think. There is more to this picture, and I will come back to it later. So now, in my practice, I also help breastfeeding mothers feed their babies. And sometimes babies have difficulty eating. And now, as a dentist, I'm able to help them. 5 years ago or 10 years ago, I don't remember when I started this, I didn't know that it was possible. It was definitely not within my imagination. But one lactation consultant really persuaded, and took her a year to convince me to start paying attention to it. It is in the mouth, after all. And I did, and I'm glad that I did, because it can make a very, very significant difference. The oral restriction. And more of that will be later. So this is one picture of a patient who had failure to thrive on the left, and he was biting his mother. She was really suffering. And this is him sometime later, after we released his restrictions, and he started eating normally. Now, I will say right away that this does not mean that all of us should run to a dentist or an ENT or a physician and have our tongue ties clipped. This is not why I say that. I'm just showing you what's out there so you can become more aware. That's it. Most of the decisions in this household, in a household, are made by women, and women really are the superheroes in my view, because they are the ones who are the soul of the family, and they're the ones who take care of the family, and they're the ones who are attuned to what's happening with the children. And oftentimes, the mother brings her kids to me and says, I don't know what it is, but I feel something is wrong. And oftentimes she's right, something is happening. And so I put this little cartoon here. And while the woman has this ability to perceive, guys oftentimes are the other way. They are oblivious to the problems, or they feel the problems will magically disappear if you give them enough time. Well, I'm here to tell you the problems that I'm treating in my office do not magically go away. If you have difficulties, you're going to continue accumulating, compounding, compensating until there is a breakdown. So it's much easier to fix a small problem than to deal with a bigger problem. So I encourage guys or men to be more involved, to take care of themselves, more importantly, because you oftentimes are the providers for the family, so you need to be in as good health as possible. Brushing teeth. Oftentimes people feel that they are brushing teeth long enough, and when I start asking them more and more, it turns out they hardly do it at all. Everybody knows that you need to brush your teeth for at least 2 minutes. And when I start asking questions, it's somewhere 10 to 30 seconds at most. And so if you want to take anything away from this webinar, is just spend more time with a toothbrush. Don't rush. Take your time. And importantly, make sure that your children know how to take care of themselves. Make sure they brush. So the new kid on the block is sleep disordered breathing, or as some people call it, breathing disordered sleep. It is when you cannot sleep well because you cannot breathe well. It doesn't have to be obvious. Most of the time it is subclinical, and oftentimes it is missed because of that. People wake up tired. People have more pain in their bodies. There are behavioral issues with children. There are cognitive problems with children. As a matter of fact, if a child is diagnosed with sleep apnea, there is a 70% chance that this child will need special education. So this is a very, very significant piece of information. There are many, many problems that go along with this, and this has become a very significant and becoming more and more significant part in a dental office, because we really are the first line of defense together with an ENT and a pulmonologist. Eating healthy may help you a little bit, taking supplements may help you a little bit, but this goes far beyond your diet, far beyond. And so there is a lot of educating that needs to happen in the general public and in the medical field. But it is getting there. There are a lot of people that are being vocal about it, and they're promoting this topic and offering solutions, some good, some not so good, but it's an evolution of thought as well. People oftentimes ask me, what should I do with tonsils? If I'm such a holistic person, isn't it wrong to remove a part of your body? I would rather sacrifice a pair of tonsils than sacrifice your child's brain. The results of sleep apnea are thought to be irreversible, the damage that's done to the brain from sleep apnea. It may not be as apparent, but it is very serious. And I see a lot of children who struggle significantly. Their families struggle. If you want to try whatever you want to try for 6 months, maybe even 12 months, to see if tonsils can shrink, by all means. But if you see tonsils like this boy has, where he literally chokes on his own tonsils, I don't think we're doing any favors for this individual in keeping them in, because he cannot breathe, he cannot sleep. As a result, he cannot be calm, he can be even nice. He can be nice. So it's a debatable subject, but parents oftentimes feel like they're failing their child because they're considering removing tonsils. And I will tell you, you need to think, do I sacrifice this or the brain? So something for you to think about. Another much misunderstood topic, a tongue tie. A tongue tie is not the root of all evil. It will not magically make you healthier. You must not run to a provider who supposedly knows what to do about a tongue tie just because you think you have it, or just because you were told that you have it. Oftentimes it needs to be done, but I believe it needs to be done when the time is right, when the preparation is there, when there is room in the mouth, when parents understand what's happening, when there are a lot of wins. Unfortunately, what I see is people are running to providers to have their tongues clipped or their children's tongues clipped, and they get practically no results. The only result that they get is that now the child is more afraid of the dentist, and it's hard for me to work with them. So it's very unfortunate that the public is driven by fear or by thinking that there is a silver bullet to all of their problems. Oftentimes, it's simply not the case. And so I urge you to educate yourself in what the proper procedure is. So now we come back to this picture, and what do we see? So what we see here, besides obviously amalgams, and by the way, an amalgam of this size, just this size, is enough for the EPA to shut down a small lake and call it to be contaminated. Yet this person has enough mercury to shut down 1, 2, 3, let's say 4 lakes. And somehow it's fine to be in the mouth. But another thing that I want you to see is how deep this palate is, how narrow the mouth is, and how this side is not symmetrical to this side. So there is a lot going on in this person structurally, as well as, let's say, chemically. And you need to decide, you have to use your judgment. Do I rush and replace all the fillings if it's needed, or do I address the structure? Addressing the structure is a long discussion. At some point, we will have that as well, hopefully. This brings me to the last slide. And I just want you to know that I'm a parent also, and just like you, I'm exhausted in the evening oftentimes, and I have the same struggles as you do. I have them at home, I have them at work, but we all take it one day at a time. and things do get better. Thank you very much.
Hi, Dr. Kundel.
Hi.
Okay, great. So we did have a question. Josh, this is the, let me just pull up some questions. There was someone who had actually messaged on the Rich Parenting phone. I guess they didn't know how to use the chat. They were asking, what is your recommendation, tooth pulling instead, and your position on implants? So I guess if there's a necessity to have a root canal, what would you recommend? That was the question. Oh, here we go. Publish it. There we go. Now you see it. There we go.
Oh, yeah.
Are you able to see that question?
Yeah. In this case, I probably would say go for the root canal because she has a lot of formative years. Her jaws need to grow. She's going to be growing until she's at least 18 or up to 18. And she needs those teeth for anchoring. She needs them for stimulating bone growth. So I would say go for the root canal if it's possible to save the tooth.
Okay. And then I wanted to ask you, I came to you, I don't know what it was, maybe a year back, and I, obviously, holistic health and alternative care is a way that I try to implement in my own home and my own family. And really a lot of the things that I had learned from you were very eye-opening, and specifically with one of my children, you brought to my awareness that how important the mouth breathing is and symptoms of mouth breathing. I'm just thinking maybe what are some things that parents can look out for just as signs, early signs, even maybe as when they're younger, to maybe address an issue, if there is such an issue, to look into it earlier than later.
You shouldn't be afraid of going to a doctor. What that means is I refer to an ENT almost every day. And the reason I do that is because I realize how serious this could be, how it's affecting structure of the face, how it's affecting central nervous system. And you need to be very clear on what's going on with your child and what you can do about it. If your 6 months old is having a mouth open, maybe there is a cold. But also don't forget that there is a genetic predisposition, and oftentimes parents themselves have these problems. What you want to do is you want to stay away from processed foods. You want to stay away from dairy. You want to stay away from bread products and anything that comes really from a cow. It's much easier to give a child a snack that looks like chips, but it's not necessarily good for the child. You need to be aware which foods make your kid more inflamed. Because if you have mucus coming out of your nose, or if you have ear problems, you will be mouth breathing. If you got a pet or there is some kind of allergy, you'll be mouth breathing. So avoiding of allergens and teaching your children how to eat harder foods, not just macaroni and cheese, not just food that you don't need to chew, but foods that require chewing. And when they do chew, you need to constantly remind them, if you can, keep your lips together. Another good habit, lastly, I'm going to say another good habit is to teach them how to clean their noses with saline water. It can be very useful. Did I answer your question?
Yeah, so basically, that being said, obviously, if we are avoiding the allergens and we still have come to find that the child has a narrow mouth and would need actually like to have an ALF or an appliance that you install. What would be what is, can you explain a little bit what the difference between what you do and just a palate expander? What is the difference between an ALF and a palate expander?
I'm using appliances that develop the face physiologically, that do not go against the growth pattern of the body. The body wants to grow forward. A regular palatal expander makes the mouth grow sideways, but also harshly. That does not open up the airway. That prevents the body from developing properly. And it also oftentimes, that type of development is not stable. So the appliances, or ALF, for example, as one of the appliances, they are physiologically friendly to the body, versus a conventional expander, it's not. It does not respect the nature of bone growth, the vector of bone growth, rather. Did that help?
Okay. Yeah, that does help. Now, would you recommend, like, if there is someone, you're located in Connecticut, is this something that there are many dentists out there that are trained or able to do what you're doing, the work that you're doing? Are there, or is this relatively a newer concept?
There are definitely people out there who are using this philosophy of growing faces at an early age and doing it gently. There are more and more people who are doing it. So it's just a matter of time until this becomes the norm. When it will become, I don't know, but there is definitely a call to action by parents and by dental professionals, and you can find those people online.
Okay. So if you don't mind me asking, how did you come into this specifically when it comes to the mouth breathing? What brought you to awareness of the importance, and was it just in your line of work you were coming across many children? Like where, if you don't mind me asking, and if you could just go in a little bit, what are the main behaviors that might be visual, like a parent can pick up on in a child as a red flag?
Yeah. I started. Hello?
Yeah, you're there. Hold on.
I started doing this about 20 years ago, and the reason I started doing it is because it was actually by accident. Somebody invited me to a seminar, and the seminar was an eye-opening seminar. They treated us, part of the seminar was also treatment, and so they showed us what a better way to breathe. Let's leave it at that. And that was almost a religious experience. And so I started paying attention more to it, and I started learning, and one thing led to another, and here I am. So that's how I came about. And plus, I'm a patient of all of this myself. I was a very sickly kid. I was sick all the time with flus, with colds. I had my tonsils out. I eventually had braces and many other things. So that was the first part of the question. What was the second part? Sorry.
I think the second part was, how did you, or if there's, what are some different signs that a parent might pick up on behaviorally or?
Yeah. The most obvious signs are your child has difficulty waking up in the morning, aggression, sadness, fatigue, being argumentative, just not being yourself. If a kid is unhappy, something is wrong, because there is no reason for a child, and I'm assuming a normal household, there is no reason for a child to be not happy. So those are the main things, and I think it's also important to pay attention to this, because kids with these issues, their self-esteem gets very significantly affected. It's a big deal.
Okay, well, I really, really appreciate it. I appreciate what you do. I want to also just say a little bit my own story. You know, like I said, I came to Dr. Kundel last year. It was by chance. I was really going just to have my children's teeth looked at. But little did I know, you know, you opened up a whole new world for me, for my family, my daughter. Specifically, I had one daughter who, you know, really did struggle very much with anxiety, and it was something that for quite some time we were, you know, trying an array of different things. Overall, she's an extremely healthy, bright child, but you know, it was mind-boggling to me, and I'll never forget it, because I come again just to have their mouths checked, and you called me out of the room and you said, you know, this child can't breathe, and I was like, what do you mean she can't breathe? And you basically then told me, went forward and said, you know, she likely has this, and this, and I was like, how did you know that? You know, I never had shared anything with you. And you literally had hit the nail right on the head. You had told me she's always in fight or flight mode, and then we went forward. Obviously, we did go to the ENT, and it was, and it was exactly what you had told us. And I'm just so grateful for your work. I'm grateful for everything. I hope that others have access now to this information, and if this can make, and like you said, hopefully this information is opening up and people are getting more aware of this issue. I don't know if we have any more time, but there was one more thing that I experienced that I think was really interesting, was when the ENT that we had gone to, he had mentioned that this phenomena of children having these small mouths. Mm-hmm. Luckily, my daughter, it was not that she had enlarged tonsils or anything of that. It was just that she had a very small mouth and a very narrow passageway. And he had mentioned that there's this increase of children who are of this generation, have this epidemic of children with small mouths and narrow pathways. What are your thoughts on that? If you have a minute to share with us.
There's an argument about this as well. Some people feel that the reason we have this is because of the Industrial Revolution. We in nowadays really have diseases of aristocracy: heart disease, diabetes, high cholesterol, and so on and so forth are diseases of the wealthy, because very simply we don't chew our food. It is processed, it is soft, and we don't do the work required to obtain the food. So our bodies are weaker. In order for us to eat macaroni and cheese, you need, let's say, maybe, 5 pounds per square inch of chewing. To eat meat, you need 300. So this is very different. But even that is not as hard as the food that our ancestors used to eat. So one argument states that because we're no longer hunters and gatherers, because we no longer use our chewing muscles to develop our jaws, is why our jaws are small, and so we can't accommodate the soft tissue that's inside of the nose and inside of the throat, which is the nasal airway and the throat airway. That's one. There is another camp that feels that there is a very strong genetic predisposition. And I agree with that, because whenever I see a kid with a problem, there comes a parent with a problem. But also what people are thinking is the chemicals that are in the water, in the air, in our food, more specifically pesticides. And the most famous pesticide is glyphosate, which gets us to be really defective. And that, I would believe that. I would believe that as well. So we are really, our physical bodies are under attack from different angles. And that seems to be what's happening.
Okay. Well, that's really, thank you so much. That makes a lot of sense, all of those things. Yeah, and like I said, the ENT that I went to, he also mentioned the glyphosate is a big thing that he felt is contributing very much to this. And also, like you said, the food. I was just curious if that was what your thoughts were. Thank you so much for your time. Really, it's an honor to have you here. And we are recording this for those who did not make it onto the webinar. We also did have a delay. Apparently there was a lot of people stuck in the lobby and they were not in the beginning. So they're all in the, so for those, everyone should be rest assured it was recorded and we'll be sharing it going forward the entire presentation. So Dr. Kundel, thank you so much, really.
All right, thank you. Have a good day.
Have a great day. Thank you. Okay.